Councillor Goldman.
Thank you, Chair, and thank you, William, for your run through of that presentation. I have a few questions. I think that I'm going to ask the one that comes into my inbox most at the moment, which is the closure of pharmacies, and in particular because you mentioned Pharmacy First and how that would add capacity to the system. In Chelmsford, in particular, I get, and I'm sure this is happening across the country, in fact, I get told about, in particular, Boots pharmacies closing right the way across the city. I'm sure this is happening elsewhere as well. And of course, we hear of other independent pharmacies that are closing as well. How does this affect the Pharmacy First strategy, and what mitigation measures are in place?
That's a fair question. I think we have seen across all three areas of Essex a large number of pharmacies close in the last 18 months. Part of that is a national trend where people are starting to use online pharmacy provision more, which is a solution for some things, but obviously won't support the Pharmacy First model. Part of the establishment of the Pharmacy First model is to try to ensure sustainability and viability of community pharmacies going forwards, to try to invest more money into community pharmacy. Critically, I think we've got to work closely now with the providers, with the local pharmaceutical committee, to make this sustainable. Otherwise, we will see, unfortunately, challenges to the sustainability of community pharmacies, and they do play a critical role in terms of patient care, and we need them to continue to do so. But I think it is a challenge and it is a concern, particularly with the big chains. We're seeing quite a significant shift in the way their models operate, but we want to work closely with the pharmacy community to try to make those businesses sustainable. And Pharmacy First is definitely a solution to that.
Thank you. I'd just like a follow-up to that then. Can you, just from my understanding then, and I'm sure members of the public who may be watching this would also like to know, how long has Pharmacy First been a strategy? And if so, why haven't these talks with the pharmaceutical the pharmacies, the pharmacy chains already taken place? And if they have already taken place, why hasn't it led to them staying open?
So the concept of Pharmacy First came out of the National Primary Care Access Recovery Plan, which was published in May of this year. There's then been negotiations with the national pharmacy body in terms of the detail, the pathways, the clinical conditions covered, etc., and remuneration arrangements around it over the last few months. That concluded nationally in the kind of back end of autumn. And then we've been on a process of implementation. I think in terms of that challenge, I mean, I can't speak on behalf of the big pharmacy chains. I think their business model meant that even if Pharmacy First came online, they're kind of strategically heading in a different direction in terms of how they deliver services. I think for some of the smaller pharmacies, they are keen to see what Pharmacy First looks like and what the kind of benefits of it will be. I think it's unfortunately it's just one of those timing issues where maybe it hasn't happened as soon as we would have liked nationally, and the certainty around what the model will bring to community pharmacy, and therefore pharmacy have made the decision to exit the market. But we do hope that as the months go by, that it will make pharmacies more sustainable.
I think just to add a little bit to that, so there's a couple of things when it comes to community pharmacy, and one of the key bits is, like the GP contract, the community pharmacy contractual framework is coming to an end as well, their 5-year contract at present. And I think the negotiations and the discussions have already started in terms of what should a new pharmacy contractual framework look like for the future, learning from some of the clinical services that up and down the country, a number of ICBs and previous CCGs used to commission from community pharmacies to enhance their role in the clinical pathways has been recognized now. And that's really important, unlike just dispensing medicines. So that whole model of to community pharmacy is really changing, and integrating community pharmacy with not just the primary care itself, with the GPs and dental and optometry, but with the wider integration partners, with all the work on terms of community pathways, with community providers and the acutes, is so critical to actually bring them into that family so that we can actually have a sustainable system. The other biggest issue, which like general practice, is really the pharmacy workforce itself. Pharmacists themselves are struggling to actually recruit and retain community pharmacists in the community pharmacy shop floors. And hence a lot of the pharmacies are running very much on locums, and that is not always a sustainable model and does not provide the continuity of care that we all are seeking for as well on it. Part of this as well, and hence it becomes a business model to actually say whether that works for us or not, and hence opportunity for all of us in the respective ICBs is to really think outside the box in terms of how can we look at recruitment retention models for the pharmacists as well, because a lot of the pharmacists who are coming out from universities will now be independent prescribers. So a real opportunity as to how we can use them as part of the clinical pathway, whether that's for hypertension or other chronic conditions. But more importantly, how do we look at retention of these pharmacies? Because nobody wants to work 7 days a week and not have a work-life balance. People are moving into general practice so that they can work as clinical pharmacists on a 5-day. But we are also losing people to other areas because they are maybe paying more as well. So we do have, just like we talk about GP recruitment retention, we now are looking at community pharmacy recruitment retention, but pharmacy recruitment retention as a whole, working with our hospitals, general practice, and the community pharmacy. So there's a lot now for ICBs who have now taken this on as of 1st of April to really start looking at other primary care contractors and how we embrace that as part of our strategies, which we've been doing for general practice a fair amount, but how do we actually refocus on all of these others?